Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Sreeram Mullankandy. He is a physician executive. Today's Kevin MD article is Bridging the Digital Divide, Addressing Health Inequities Through Home-Based AI Solutions. Sreeram, welcome to the show.
Thank you so much, Kevin. Thanks for having me. I'm Sreeram Mullankandy. People call me Sri. Feel free to call me Sri. Very excited about getting to speak about my article and other things in SDOH.
All right, fantastic. So just tell us a little bit about your story and journey and then what led you to write this article at Kevin MD.
Definitely. I'll start with a quick background about myself. I'm Sri, so I'm a medical doctor from India. Then I taught in the same medical school for about a year. Then I moved into the corporate side. I did my MBA from Boston University in health sector management and entrepreneurship. Handled product roles in multiple companies. For example, BK Medical, Davita, Humana. Recently in Bioformance, which is a health tech unicorn, and now I'm with a company called Illumina Health, which is a new company, and we are building an electronic health record specifically for home-based healthcare or home healthcare with AI capabilities. So apart from that, I also am a judge and mentor for multiple startup accelerators in the health tech world, Mass Challenge, Techstars, MIT Launch, etc., etc. Yeah, recently, as you rightly pointed out, I got an opportunity to write an article for your platform as well. Thank you for that opportunity, and would like to speak to you more about it.
Yeah, so tell us about the article for those who didn't get a chance to read it.
Yeah, so in this new age of AI, right? One of the things that struck me when I joined this new company and started building HR, right? When I first ventured into health tech, I would say like maybe 8 years ago. At that time, things were quite difficult. These days, because of the advent of AI, a lot of things have become much more easier.
Mm-hmm.
Once I started moving into home-based healthcare, initially my focus, because I'm a clinician with the background, right? I was very narrow focus or tunnel vision around what I can do to the patient's ailment, or how to focus entirely on the patient. And we are especially focused on improving clinical outcomes, right? I did some research, and we were also trying to improve our outcomes, and we faced some roadblocks despite the best efforts, so to speak. Then I figured out, did some research, and found out that only 20% of the health outcomes are directly related to the clinical care that you provide.
Mm-hmm.
80% of it is actually related to SDOH, social determinants of health.
Yeah.
So I somehow knew about it at a high level, but did not focus too much about it until a few years ago. So that was a revelation for me. And then I started thinking about what are the different things that we can do to intervene in that area also, even if you're a clinician and even if you're a healthcare organization. To give you a quick for the viewers and listeners, right? So social determinants of health, they are a broad set of other factors that come into picture that is not entirely clinical care. For example, primarily related to, I would categorize into three categories. That is food security, home security, and
Mm-hmm.
also transportation. There are multiple. Obviously,
Mm-hmm.
those are the three broad categories. But it was surprising to me when I first figured out that 80% of the health code outcomes are related to those three areas and the factors that affect them. So we started intervening, or try to intervene in those areas. Initially, in the olden days, I would say like even about maybe 5 years ago, it was very difficult. But because of the advent of AI and everything, it's much more easier for us as health tech professionals and executives to intervene in that areas and deliver outcomes. So I wrote an article about it, different ways in which we can leverage technology to address that, and that's how we are here.
All right. So you mentioned that 80% of health outcomes are influenced by these social determinants of health. So you work for a health IT company, improving clinical notes. So from that perspective, how can we address this issue?
That's correct. A minor expansion on what you addressed. I work in the health tech division of a larger company. So our
Mm-hmm.
company initially started as a home healthcare organization only. We were a service company. We grew very much from a few dozen patients to now we handle about maybe 800, 900 patients on a daily census. Very quickly in about 3 years, I would say. So very, very rapid growth.
Yeah.
And we are building an EHR for our own use first. Once we built out the MVP, then the other organizations started asking for it. So now we are opening it out to
Sure.
market. So I belong to the health IT side of a larger healthcare company.
Okay.
Yeah. Having said that, one of the things, right, the patients have a lot of clinical notes, a lot of data points. One of the challenges that the clinicians face is, despite all the other mountain of other documentation and paperwork that the clinician have to do, it's very difficult for them to go to all the details, patient by patient, especially when you have thousands of census up to thousands, right?
Yeah.
To identify what are the social determinants of health factors in each patient's chart and everything of that sort. With AI, we have been able to analyze the patient notes and vitals and other parameters included, right? Including demographic information, where the patient stays, their location, their zip code, everything of that together combined. And the AI system itself will analyze it at a larger scale for thousands of patients at a time and point it out to the clinicians or other healthcare workers as such. What are the challenges for this particular patient when it comes to SDOH? And what are the possible interventions that we can do considering the patient's demographics, location, and specifics as well. Yeah.
So give us an example of what that would
Oh
look
yeah,
like in action. So you
yeah,
mentioned that you use AI techniques to comb through the medical chart, and using all
that's
these
correct.
data points, it can alert the clinician that social determinants of health may be influencing some of their health outcomes. So give us an example of what exactly that would look like.
That's correct. Yeah. So right now we have about 800, 900 patient census. So going to patient chart one by one is very difficult. Now we run an algorithm, an AI, Gen AI based algorithm, which goes through the patient chart. It's able to identify with 85%, 87% accuracy on which patients are the ones who need social determinants of health intervention, SDOH intervention,
Yeah.
at the high level. So that helps the clinicians or basically healthcare workers in a sense that it gives them a short list of these patients to reach out to and intervene in their next visits because we send clinicians to their patient location as well. And what exactly are those interventions? So we already have built a network across, let's just say food pantries and meals on wheels and some housing organizations,
Mhm.
etc., in the area that we serve. So we are easily able to coordinate the activity and connect the patient to the required type and level of service that they need when it comes to SDOH.
All right. So any studies or data or outcome studies from this type of intervention that can kind of like show that there is a definite improvement in patient care?
Yeah, so part of it. So this is the larger algorithm that we're talking about. The
Yeah.
first part of it is already out. I've written a paper about it, which is AI risk stratification, AI-based risk stratification. So this one will give an overall score of the patient risk profile. This includes everything, including the social determinants of health factors. But it will also point out the top 3 or 4 factors,
Mm.
which gives rise to this particular risk score. So this is not a blind risk score like many other AI algorithm that you have that the patient is of like 90, 97, 95% risk or something of that sort. It will also point out to you because of its explainability, the top 3 or 4 factors and how much do they contribute. You know. Now, this was the initial foray into, why we thought, okay, we can add the social determinants of health factors as well. But specifically on the reading of social determinants of health itself, I haven't written a paper yet, but it's in process right now. Yes.
So, from the perspective of a physician, they get an alert that this patient's health outcomes may be influenced by their social determinants of health. What exactly would that physician see? Would they see the specific such
Mhm.
social determinants that are affecting it? Like you said, either food security, transportation issues, housing insecurity. Tell us what kind of data that physician would see.
That is correct. So for example, let's just say use an artificial name. This is not the real name. Let's just say John Smith, right? So on that particular day, he has a home healthcare visit.
Okay.
So on that particular day, when the clinician looks at their chart, they see that they have a scheduled visit with this particular patient. They will also see a risk score for that patient, and whether it's a high risk, medium risk, low risk, and what specific risk score that is. So let's just say it says like 75% risk of rehospitalization. That's the outcome that we're looking for, and it will also tell you, okay, why this particular patient has been classified as a high risk because of what factors. So one of the factors would be like patient's vitals contribute to 50% of the risk, that puts the patient at the higher risk. Also, it may also tell you that patients food insecurity, home insecurity, and
Hmm.
other factors. By knowing that what on the day of the patient visits itself, before getting to the patient, if the clinician or whichever healthcare worker is going to visit that patient knows that this patient has these challenges, then they are prepared to intervene in that manner as well. So when they visit to that particular location, if it is food insecurity, let's just say, our system will automatically populate the food assistance resources in the local area.
Hmm.
You know, so the clinician can provide the corresponding information to the patient and also alert the corresponding organization to get in touch with them and then follow up in the next visit to make sure that they've connected and bridge that gap, particular food insecurity by meals on wheels or whatever of that sort. Yeah.
And what do you see as the next steps in the foreseeable future?
One thing that I definitely started off with is the ability to read patient's chart and
Yeah.
obviously ability to intervene in that regard. But also when you look at it, a lot of patients have so many other challenges also. Mental health, for example,
Yeah.
the addiction, substance abuse, and things of that sort, right? So many times what happens is the clinicians that we sent over there or the health professionals, they may not have all the all the specialty information or specialty knowledge to actually intervene or advise on that matter. Because of trained algorithms that we have, especially with
Hmm.
Gen AI capabilities, they will be able to actually do a quick search, or even the AI can listen itself and it can provide suggestions, or okay, these are the best way to intervene in this particular patient's regard. You know, so an example would be, this is already this in development right now. We are not launched it yet. That is a particular, our AI clinician can also listen in while you
Hmm.
have your patient visit itself. And for challenging areas where you need specialty care, obviously you can set up a specialty appointment for later. But in the meantime, there will be specialty suggestions also provided to the clinician, which they can pass on to their patient as well. You know, so that itself helps in dampening the issue a little bit by the time the specialist responses could be made available. And even on otherwise, because you want to expand a little bit, there are many interventions these days, especially everything does not have to be super high tech. For
Hmm.
example, telehealth visits and things of that sort, right? Which could be arranged for the patient, even if as an organization we don't have this capability of, specialist, substance abuse specialist, or anything of that sort. We can arrange for telehealth visits, etc., so that the patient will get the required type of care, which may not be available with each clinician specialty or each organization, so to speak. Yeah.
We're talking to Sreeram Mullankandy. He's a physician executive. Today's Kevin MD article is Bridging the Digital Divide, Addressing Health Inequities Through Home-Based AI Solutions. Sri, let's end with some take-home messages that you would like to leave with the Kevin MD audience.
Oh, yes. So this is a general message, I would say. I worked in multiple organizations on the provider side, patient side, even on the payer side, etc. Right? And right now I'm with home healthcare or remote patient monitoring, those areas. I would say the industry lacks a lot of clinician leaders to get into business as well. You know, so one of the things that we did not know, one of my blind spot I told you, is the SDOH factor, how much it affects.
Mhm.
Similarly, what I did not know was how vast the healthcare industry itself and what are the different gaps slash opportunities that you have. There are usually the stakeholders who are trying to bridge that gap. These are finance professionals, or business professionals or tech professionals. They may think that they have the entire perspective, but they don't. In I can come across it on a day-to-day basis.
Mhm.
Half my time is spent on why we should not do a certain thing, because
Mhm.
they may think it improves efficiency by the numbers, but there are qualitative aspects which only a physician or a clinician can provide. You know, but when I speak to a lot of clinicians, they are okay with visiting the patients and taking care of the clinical care. They're not really into intervening into the business development side of it or onto the technology side of it.
Mhm.
You know? So the industry is in dire lack of clinicians, really, if you really wanna, open up your perspective a little bit and venture out a little bit. And that is, for example, with value-based purchasing option, right? Purchasing opportunities right now. The Medicare and Medicaid costs are, going higher year by year, and there are managed care organizations in almost every state. All you got to do is, with a bunch of clinicians, if you're really good at what you do, create an organization, get into a contract with an MCO to, on the basis of improving outcome for the cohort of patients that you choose. Once you prepare a plan, you can even use Chat GPT, I would say, to prepare a draft for it. It is actually not that difficult. You have to get through the your mental hurdle of getting into the business side of it.
Mhm.
Examples will be Oak Street Health, for example, just primary care. They selected their patients widely, and they're helping thousands and tens of thousands of patients and built a huge company as a result as well, right? Similarly, there are many other patient cohorts also. All you got to do is get ready with a plan and reach out to your respective MCOs. Things won't happen overnight, but overall, 2 years, 3 years down the lane, it will be beneficial for the entire patient community and also you as providers as well.
Sri, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much, Kevin. Really appreciate it.